Assalamualaikum warahmatullahi wabarakatuh and a very good day to all participants. Hi, my name is Nurul Fathin Amira binti Wama Asnam and you can call me Fathin. So today, my poster presentation will be on the fight against dengue and malaria at the biggest construction site. Before we start, let me share you briefly about myself. I am industrial hygienist working with Petronas since 2015 at construction, projects, and also operation. Currently, I'm attached at Petronas Chemical Isononanol Sdn Bhd. Let me share you my screen on my poster. Before we start, I would like participants know that previously I was attached at PRPC looking for rapid project, the biggest construction site as industrial hygienist. And this is one of our big initiative that I would like to share the lesson learned to all participants for your future guidance or reference. Okay. The fight against dengue and malaria. A presentation on efforts towards the eradication of dengue and malaria at the biggest construction site. Why I call the biggest construction site? Because Pengerang Integrated Complex, PIC, formerly known as Rapid Project, cover area of 6.2 acres in the Pengerang, Johor itself. Can you imagine 3,500 football field? Yes, that's how big is PIC. So during the peak construction period, there are almost 65,000 workers from 14 different nationalities. Therefore, we have a lot of health hazards associated with different nationalities. So with the facilities like accommodation, most cinema, most of the workers stay at the temporary camp facilities. This is where a part of we need to think about the hazard at the construction site. We also have to identify the health hazard at the accommodation site. Okay, so what is our goals? Our goal, of course, is to protect, promote, and maintain the health and safety of the people. Secondly, we want to provide safe and healthy condition by assessment of the physical and psychological aspect of the working and living environment. This reflects to the accommodation and also the construction site. And then lastly, we want to advise contractors on the probable or associated factors to the disease outbreak and the means of their prevention and control. This is the most challenging part because they are not aware what will happen if there is disease outbreak or masses of cases due to dengue and also malaria. So what we achieve from our commitment? Of course, we have a significant reduction of dengue cases at PIC, zero number of summons issued by Ministry of Health. This is because previously we have like 5 summon, and then that is why this issue raised, and we don't want any of the contractor be summoned by Ministry of Health. And then we successfully identified the risk and the types of mosquito breeding areas. I don't have any idea that Aedes have their Aedes have their own breeding areas, and also Anopheles the mosquito for malaria have their own type of breeding areas. And then the high risk areas also identified in the map. So the contractor can focus which area they have to give immediate intervention, and then which area that they can just maintain. So let's move on to our continuous activities in preventing dengue and malaria illness during the construction. Firstly, we have a collaboration with Ministry of Health. We have a smart partnership with Jabatan Kesihatan Negeri and also the Pejabat Kesihatan Daerah Kota Tinggi. There are several activities that we did together. It started with a small discussion, feedback, and also sharing on our concern, and also we request their feedback on what what is their expectation from us. So from there, we did a joint venture investigation, we did a Moses survey program, we did a vector control program, and also we invite their expertise, their entomologists, and also their public health doctor, give training to the staff, and also as a trainer, so that all the staff can go back to all the contractor worker can go back to their area and give the awareness to all workers. So from the collaboration, we decided to appoint a task force team called Mosquito Prevention Program. These task force are meant for contractor to have their own ownership to lead the mosquito prevention at their site, at their respective site. So each management have to prevent at their site and be inspected by our team weekly and also periodically. So to ensure this prevention program are successful, we collaborate with the environmental team from the contractors. This is because they have this search and destroy. They have a routine site walkabout. Therefore, they are the best person that go to the site every day, and they can assist to conduct search and destroy activity at their own area, as well as mosquito breeding area survey. So from the prevention program, collaboration, part of that, the most important thing is the continuous awareness program and also communication. We have in-house training, we have poster, we have banners, and also we share all the risks and also all the lesson learned to all the contractors. If there are investigation on cases, all the outcome will be shared to the contractors transparently. So from all of these key activities, I hope participant can I hope this will be a beneficial tips and also guidance for you in order tips for you to manage dengue and malaria at your own construction site. I believe other than construction site, you can also adopt this at your plant or at your working area. So below is some of the photos what we did together with the team, the Ministry of Health team. This one is the site survey. This one is the Mosey survey verification. This is the entomologist doing the research and then verification. This is the team. We catch mosquitoes day and night for 3 days. And then this is the unit vector team that conduct larva siding activity. That's all from my side. If you have any question, you can ask. Um, thank you again for your time and also participation. With that, I end my presentation. Thank you.